Yes, I had a structure, and I will recommend to any registrar as well, especially IMGs. My initial mindset was that, it will be an easy thing to do, just recording my consultation and just submit it. I would be honest, in the beginning when I watched back one of my video, it didn't look right to me. There was no flow. It sounded more formulaic, and then I said, look, this is not an easy job, so I have to do some work for it. I mean, the first thing is that you should have a good relationship with your trainer to get him on your side. I mean, you discuss things with them, what is my weaknesses, and I mean, I had a discussion with my trainer and asked, how can you help me with that? I'm thinking if I can have a separate day on which I can only do recording, will that be possible? And he said, yes, I think we can do that. And so that was one thing. And second was that, I used to do my best 4-5 recording. I used to send him in a week for reviewing,
Welcome to RCA in Focus. In this series, we dissect the strategies, tactics, and tools to help registrars crack the RCA. Today, I'm joined by Dr. Wajid Shah, a registrar who recently passed the RCA in the March sitting. If you're serious about passing the RCA and you don't want to take risk and you want to go with somebody who's already done it and help other people, then book a call with me to see whether I can help you. If I can help you, then we can book you on a one-to-one coaching program. If I can't, at least you'll get some clarity in your preparation. Hi Wajid, how are you doing?
Yeah, I'm doing very well. Thank you very much.
Congratulations on passing the RCA. Thank you for sharing your experience with us today. So for people who don't know about you, tell us a little bit about your background.
I did my graduation, way back in 2001, from Pakistan. And then I came over here and so I was working in A&E for good 10, 12 years as a registrar. And then I switched to to general practice. So I've been working in a hospital for a while and then switched to general practice. It was a big change, in terms of, interaction with the patients.
Yeah, so with your choice to go into general practice, then understand that when you were taking the RCA, you had some difficulties. Could you tell us, how did you prepare for the RCA, Wajid?
My initial mindset was that, it will be an easy thing to do, just recording my consultation and just submit it. But I would be honest, in the beginning when I watched back one of my video, it didn't look right to me. There was no flow. It sounded more formulaic, and then I said, look, this is not an easy job, so I have to do some work for it. So and that's how I started watching different consultation, different people, and watch your videos as well on YouTube. And and then I have some courses, and one was with you as well. You helped me with those small things which helped me in doing my the recording and for the final submission.
So with your preparation then, when you felt that there was no flow, you were struggling, could you tell us what exactly was a problem with these issues that you were having, Wajid?
The same problem, I think it is with many registrars, taking too much time on data gathering. Initially, my perception was that, there are three domain, data gathering, interpersonal skills, and clinical management. So I thought clinical management will be 4 minutes for the last, and spending 8 minutes, sometimes 9 minutes, on data gathering. And then the clinical management was not like shared. So it was just like, because I was rushing through and finishing. So the timing used to be 13, 14 minutes, so that was a problem. And then I after discussion with you, try to finish data gathering within 6-7 minutes, maximum, and then clinical management. So interpersonal skills, come in between the two, in the data gathering, at the same time the clinical management. So, and I think that started to work for the last month. And when I did my final recording, so I was well in time and still not rushing. So it was just like a conversation with the patient rather than, bombarding the patient with the questions and then, telling what to do.
That's right, yeah. That's a common issue that registrars have, where they think that they need to work on the clinical management, but if they think a little bit deeper, the problem starts in data gathering, where they're taking too long, which is what's affecting the clinical management. So when somebody can change the time, where they can switch from data gathering to clinical management at 6 minutes, then it gives them more time to address the clinical management, and they're less stressed, less rush, and they can get more marks in clinical management. So when you were preparing, did you have a structure with your consultation, Wajid?
Yes, I had a structure, and I will recommend to any registrar as well, especially IMGs. I printed it out, my own sort of, and laminated it. So it used to be in front of me, and I just, in the beginning, and then, doing again and again, I memorize it, it was a natural things to come. But in the beginning, because it was majority of my consultation, recording that was telephonic. So it was in front of me, I laminated papers, and yeah, so not to forget things, and yeah.
Right. So with regards to how you develop your consultation, what did you use? Because there are a lot of different consultation models out there. What did you use, and how did you shape your consultation?
So I made my own sort of, what question I'm going to ask, and what question, just to, in the presenting symptoms, in date, perspective, asking the question, and try to make it relevant to the patient, rather than, if I don't need to ask, about alcohol, I never asked, if that was not something, related with the symptoms. So that sort of, so yes, just I made my own, yes, your one, that helped me as well, but I did just a few things to that and just made my own, with which I was more, used to.
Yeah, I think it's very useful process to try and work out your own consultation model, so that you have a framework that works for you, because everybody will consult differently. And it's a good point that you mentioned about alcohol. Some people would think that they need to ask about alcohol to get marked for psychosocial, but actually, if it's not relevant, you should not be asking about this. So even having a framework, you need to make sure that you're asking relevant question and not just going through a checkbox.
Yeah, and so that's exactly I did. So rather than asking alcohol, so I made why I'm asking this, because like, in depression and alcohol, so made it relevant to that case that, yes, people do turn to alcohol as a coping strategy. And so I just, do you drink it all? So in that way, like smoking in the same way, if somebody's having a chest pain, and so smoking can increase the risk of, heart attack. So do you drink? Sorry, do you smoke? So made it relevant. Why are you asking anything? Like, elderly person asking, do you live by yourself? No. I was asking, do you have any help at home with you? So those sort of thing. Or in a depression, do you have any friends, or do you have any family to share your thoughts with? So made it relevant to the patient, asking the question.
That's great. Yeah, I think it's very useful when you actually relate the question to the presenting complaint, so that you ask the question in context, so the patient has an idea why you're asking this question, because sometimes, especially with IMG, they think that they need to ask XY question, but the way they phrase it can come a little bit odd at times.
That started to give me a flow as well, all these questions rather than, me asking the question and, the patient answering, and the patient had no idea whether these are relevant or not relevant at all, and that developed a good rapport as well. So if you're jumping from one topic to another topic, just try to correlate those two. And again, make it a more like a flow. If the patient started something, just go into that flow. Like, if the patient, in the beginning you said, well, I'm in chest pain and I'm thinking it is coming from the heart. And so that the patient has given you impression already, and maybe some, and you can just go into that detail rather than, doing your way, asking the question, do you be short of breath with it, or all those questions, and then you can give what do you think it is causing. So just go straight into that. Okay, so you think it could be the heart attack, and just expand on that, and then don't ask like what you thought the cause for your symptom is. So, and that is giving you more flow and more natural and more like, not formulaic.
That's a great point. Yeah. Picking up on these cues that patient actually drop and then following up on that cue. And then this will give you a better flow when you're asking follow-up question and you have a natural conversation that goes back and forth with your patient rather than going from one topic to another and going through a list of questions in your head. So yeah, that's a very good point. And is there any things that you would say as an IMG you would recommend other IMG to do, Wajid?
Yes, I would. One-to-one, when I heard that, that really helped me as well. And, I had the same discussion with my trainer as well, just to, obviously English is not our first language, and we sometimes more like, the doctor-centered sort of approach usually. So general practice is more like about the patient. So let the patient talk, let the patient leads the consultation. So I would say that rather than, just telling the patient what to do. And yes, there are a few things we do, which is quite common with IMG. So if somebody listens to you, your consultation, your trainer, so that they can advise, just tell them what should I do in the interpersonal skill, how can I improve that? So sometimes, it's personal thing, but yes, that really helps if somebody give you an honest opinion about, the words you're using, sometime not using the same words again if you have a vocabulary problem, or use it in a way that it looks more natural.
That's great. Yeah, the phrasing of questions and how this comes across to the person who's listening, that's very important. And as you said, sometimes there can be a patient-centered and a doctor-centered type of consultation. And depending on how people consult, if it's coming across as doctor-centered, then it's more difficult to score well in interpersonal skill. And listening is so important because so often what happens is that some registrars are too keen and they're not listening, they're asking the question, and they don't get the patient's story out there. And then they have to work harder to get the story by asking so many closed questions. But if you let the patient talk and then get the story, then it makes the job much easier.
Yeah, absolutely. And that saves you a lot of time as well. The patient gave you everything, in the beginning. They might tell you about the work. They might tell you about the effect of the symptoms on their social life. So, you don't need to ask those questions later on. So yes, I agree with that. So
the other thing is that a common problem that registrars face is that they get patients who are talkative, What have your experience been when you come across somebody who's talkative?
Well, a couple of things. So depending, if the patient is giving you, if the patient is too talkative, sometimes you can't cover everything, So I would say that's a bit of bad luck for that consultation. But, if a sort of a sensible person and, talking something, so they are talking for a reason. And usually the relevant things that they're talking about, So I think I had a couple of consultation, which really helped me in that way. The patient was really talkative, and in that way, the more talkative person is, the more easy to speak to, that you develop a good rapport with them. Those sort of people, and you can get a lot of information without you asking them. So so it's good. But, sometimes if it is too talkative, you can't cover it. So it's not good for the exam. But yeah.
That's right, yeah. So some patients might not be suitable for the RCA if they are too talkative, despite you interjecting and trying to read back control of the consultation. But there are things that you can do to make sure that you make use of a closed question or the way you're asking the question to actually navigate the consultation. So tell us a little bit about how you set up your clinic, Wajid.
Well, first thing first was that depending, what sort of cases are you submitting? Because my after doing some recording, I thought probably I will do more telephonic. So. So I did majority of my recording on 14 fish. So it is easier to do. So I did use, the headphones. I did make sure that it is on maximum volume. So, I noted on few of my consultation that my voice was quite low, or the patient was not where the volume was low. So I made it that. Make sure that's okay. And in terms of so there is some preparation before the consultation. The symptoms are just go through the patient notes, so everything about it, and the BNF in front of me, already open the window, the NICE guideline already open. And if there are a few medication, so I just roughly know what it is, the in a simple way, how it's gonna work, explaining to the patient. So and especially again, being an IMG, to in a simple way how to explain common condition like depression, So I had that so I had the words in my mind at what I'm going to speak, if that comes in mind, like diabetes or high blood pressure, So you should be fluent in a few words, in a simple words, to explain the diagnosis.
So how long did you take to prepare your consultation before you're going to see your next patient then?
I was lucky in a way that, I had a separate recording day, which I agreed with my trainer. So I had enough time. So usually, 15, 20 minutes, I used to work on that, everything ready and beforehand. But obviously, if I was doing, like a headache case, so if we do 3, 4, 5, 6, then things, come natural. So the more practice you do, the better you get. You get in the recording as well. So that helps.
So what you were aiming to do is that you're getting the same type of presenting complaint on the clinic, so that you were more practice on these topics. Did you actually swap cases with your colleagues, or did you book them yourself?
Yes, so I did. So what I used to do is, I had this conversation with my trainer, whether it will be possible that I can have a single day in a week where I can just do the recording. And what I used to do, if there was a good case, then I agreed with the patient, the patient will be happy for me to call on this particular time, and I will record it for for my training. And so I used to put that case on that day. And swapping, yes. So I used to go early, a bit 30 minutes early than my scheduled time. And my practice was good in a way that it was a large practice, and I happened to be the only trainee. And there was 5-6 GPs, on the floor. So I used to go and go through all their patients, and I had an understanding with them. So I used to swap, and sometimes they used to tell me, okay, I got this case. Will that be a good for exam? And I say, yes, put it on my list. So
sounds like you had a practice where they were very supportive of you and helping you to find these cases. When you had this discussion with your trainer, what did you say and how did you ask it? Because some trainees are a little bit intimidated to ask for getting cases booked by their own or swapping. So how would you say that this conversation should go?
I mean, the first thing is that, you should have a good relationship with your trainer. So get him on your side. I mean, you discuss things with them. What is my weaknesses, and I mean, I had a discussion with my trainer and asked, how can you help me with that? I'm thinking if I can have a separate day on which I can only do recording, will that be possible? And he said, yes, I think we can do that. And so that was one thing. And second was that, I used to do my best 4 or 5 recording. I used to send him in a week for reviewing, so I was aware that not to bombard him with all not very good cases. So if something which I thought was good, I used to send only those to him. So not to or make him overwork with my stuff as well. So I think it's very good to have that discussion and with your trainer, and which helped me.
That's a good point. Yeah, I think this discussion needs to happen very early in the preparation. And if you have both of you, the trainer and the trainee, a good understanding and expectation, then you know how things are going to work. And also, if things are not working as well, then you can let your trainer know, and then things can change. Because this is something that where you can have some experimentation and see which clinic setup works best for you. And it sounds like you've managed to get a good balance of cases during the days of your recording. And you were very selective in terms of the cases you're sending to your trainer, because you're aware that your trainer can only review so many cases. So tell us a little bit about the case selection then. What are the cases that you actually selected to submit for the RCA?
Yeah, so what case? I did two depression cases. I was, so both were, nearly similar, but, and I chose sort of mirtazapine as an antidepressant, because the problem more was the insomnia. So, to personalize to that, to the patient, symptoms. So two were depression. And child, I had one. It was a viral induced wheeze. So one was I think 1 year old. I did two children. One was bronchiolitis. In women's health, I had a nausea and vomiting in pregnancy. Initially, I thought it would be too simple, but I think there were quite a few things with that patient. So that was my women's health. And in acute, I had a postmenopausal bleeding, which I had referred as a 2-week referral. And over 65, I had in fact 2 again. One was a request for PSA, and second was anemia. Iron deficiency anemia query cause. So we arranged some investigation for that. And long-term condition, hypertension. So there was a lady who are known to have hypertension. She was on a 1 antihypertensive when our blood pressure was high. So I added another and did some investigation. And one was ED.
So were all the cases telephone consultation, or did you do a mix of other consultation format?
So I had only 2 video, but the rest were all telephone. And the reason for that was that one was, I was more comfortable with it. And the second was that majority of video that needed examination as well. And, switching from history taking, doing examination, coming back, few things going behind the curtain, coming back. So, I was not able to complete it within, 12 minutes. So that was the reason. So doing more on telephone rather than, face-to-face.
Can you tell us about the marks then? What did you score overall for the RCA?
Ironically, I got similar in all 3 domains. So I got 152 total. And I think in data gathering was 51, interpersonal was 49, and clinical management was 51. So yeah,
okay.
So 152. So they were nearly the same.
Okay. So was there any thing that you found very useful in your preparation? What sort of resources did you find very useful?
The resources, yes. Well, I had a couple of courses. One was the Royal College course, MRCGP one, and one was I had subscribed to the 14 fish, package as well. So these were, and the course I did with you, the 1-to-1. So those, and majority was, just the practice. And I was trying to do some more like, copying people, and then, I thought, that's not working, and then started to have my own style, and I think that worked. So majority of my recording, came in the last 2 weeks.
So if you had to go back and speak with your younger self who was starting to prepare the RCA, what piece of advice would you tell that younger self?
Well, I would say to give yourself enough time. 4 months, I think that will be ideal, rather than rushing, and make sure that what sort of cases you are submitting, so you will stick to that rather than you recording everything. So that will be a good thing. Third would be to select a day that look, I'm doing mental health on this day, because you're more used to that tone, more used to that sort of, style. Is slightly different for mental health. And if you're doing 3-4 cases on that day, definitely the best will come on that day. So like in my mental health, both came on one after the other. So two recording I did, and both of them I thought, well, that's good. So I should record them.
That's a great piece of advice. Yeah. So to people who are listening or watching this and who are thinking about doing the one-to-one coaching, what would you tell them? They're still thinking and they're not sure whether that's a good fit for them.
I think it is a very good thing, because that advice will be more personalized to you, because we have some sort of habits, which we think they are normal until unless somebody, give you a honest opinion, honest criticism that, look, this doesn't sound professional. So, there were a few things you picked on it, and I tried to not to do those, and, that helped as well. And that helped in the interpersonal skills mainly, because the respect giving to the patient and, all those things. So, yes, one-to-one is very good in that way that, you get personalized sort of, criticism, and just follow that,
So thank you very much. In terms of sharing your story and telling us how you manage to score well in the RCA and what sort of things that you work on that really help you. And I'm sure a lot of IMGs who's watching this will find that very insightful, especially when they struggle and they're finding that they're asking questions that's come across formulaic. Is there anything that you'd like to share to wrap things up? Wajid?
First thing first, give yourself enough time, have a good, discussion with your trainer, and just practice. So not too much worry about, you won't be able to get cases. Cases will come to you. So just practice, and that's how you get into, you can improve.
Great. Thank you very much for watching until the end. Take care, everybody. Bye-bye. If you found this video useful, then I've got another video that I'm sure you're going to enjoy. This is a video where I sit down with another GP registrar who cracked the RCA. Take care, everybody. Bye-bye.